This conference will now be recorded.
Excellent. Thank you all for joining us this afternoon. The Meridian Chamber of Commerce, in partnership with the City of Meridian, the Central District Health, Crush the Curve Idaho, and numerous partner organizations and individuals, are proud to announce today the launch of a program that will assist Meridian businesses as they reopen for business. Our campaign will not only educate businesses on the basic guidelines to reopen based on Central District Health and CDC guidelines, it will also allow businesses to demonstrate to the public that they are doing so in a manner that will keep Meridian healthy and open for business. Online with us and speaking today are just a few of the partners and organizations that have helped develop this program and support the Meridian business community. With us today are Cheryl Adams, CFO of PKG Incorporated and the current board chair for the Meridian Chamber of Commerce, Treg Bernt, the Meridian City Council President, Mayor Robert Simonson, City of Meridian, and Natasha Ferney with the Central District Health. And we also have joining us Dr. Tommy Alquist, CEO of BVA Ventures and Crush the Curve Idaho. We will open it up for questions at the end of the presentations. So with that, let me turn it over to our board chair, Cheryl Adams. Cheryl?
Thank you. It is my privilege on behalf of the Meridian Chamber Board to be on the webinar today with all of you. We appreciate our government and the city officials during this tough time that's going on right now, as well as we want to thank and appreciate the team that spent several hours, dedicated their time and commitment to the business community to help put this campaign together. And we know that it will require that we all undertake measures to reduce the further spread of COVID-19 as the businesses start to reopen. On behalf of the board, the Chamber is dedicated to providing education and resources through this Keep Meridian Healthy campaign to assist and support our business community to reopen in a way that is safe and sustainable. We want to thank our speakers today and our participating sponsors for bringing on this webinar and the upcoming webinars to provide the information and guidance on best practices for reopening. And one of the original members of the group that helped put this program campaign together is the Meridian City Council President, Treg Bernt.
Make sure you unmute, Treg.
Thank you. You think I've been on these Zoom calls for at least a month and a half. You think I'd know that the red button means mute, right? Very grateful to be here this afternoon. I wanted to say thank you, to start off to say thank you to the Meridian Chamber of Commerce, Sean and his team and the board of directors. You guys have been instrumental in this campaign. Grateful for the committee that was put together early on to make this campaign work, and our partners who've gotten it done, and also Mayor Simonson and the City of Meridian and for his support. The Meridian City Council partnership with the Meridian Chamber is very important. We've accomplished a lot over the years, and we've truly cherished that partnership. City of Meridian has always been pro-business. We always have been pro-business. We are pro-business, and we always will be pro-business. I'm grateful for all of the small businesses and what they mean to our community and our city. This campaign, Keep Meridian Healthy and Open for Business, is so vitally important. It's a blueprint on how businesses can help businesses, and I think that's what's most important. Sometimes you see the heavy hand of government involved in these type of campaigns and initiatives, and ultimately at the end of the day, who makes the best choices for themselves, highlighting personal responsibility, are the small businesses themselves. In this, I believe that this campaign highlights that. Most important, it helps the citizens of Meridian have confidence that Meridian businesses have done all they can to create a healthy environment for themselves and for their employees and for their patrons. At the beginning, when this all started, and especially within the last 3 weeks or so. I've never bought into the notion that keeping Meridian healthy and open for business couldn't work together. I've always thought that, we can find ways to be healthy, to keep people healthy, and also do business. And I believe that this campaign proves that. Hopefully, this campaign can help other communities and businesses as well. So on behalf of the Meridian City Council, we're grateful for this campaign and for what it's going to do for our city.
Thank you, Treg. Mayor Robert Simonson has been a supporter of the Meridian Chamber of Commerce long before he was elected mayor last November. And we deeply appreciate the partnership we continue to have with the mayor's office when it comes to supporting Meridian business community. Please welcome Mayor Robert Simonson.
Thank you, Sean, very much. And first, I want to just echo what Treg really highlighted about this being an initiative from the community. The city is part of that community, but it was really the business community and some of our other leaders in the community who really got the passion behind it, including, she's still Mayor Tammy to me, Mayor Tammy and Dr. Alquist, Jeffrey Hall. There were many individuals that really kind of got this going. And I just want to make sure that we recognize the community effort that we have before us today. Keep Meridian Healthy Open for Business to me is all about the confidence for the employees and the community in returning to normalcy. We support this very important led business campaign, and it's going to help business reopen while keeping our community safe and healthy. And we need that if we're going to ride out the length of the COVID-19 virus in our community, in our state, and in our nation. One of the things I'm pleased about is in my conversations with the chamber regarding this program is it's really going to match the governor's Rebound Idaho plan. The information will be provided to businesses as they are able to reopen, those that do so in that fashion. So you won't be able to have the information if you're not supposed to be open at any given point in time. Doesn't mean they can't learn beforehand and create the plans, but that gives the community the confidence that this will be hand in hand with how that rolls out. I'm also pleased that it includes those community-facing elements to assure employees and customers that participating businesses have made the commitment to learn and implement the guidelines in place. And I look forward to having this information proudly displayed here at Meridian City Hall and other facilities to show that we are committed to this campaign as well. So whether you're a business that has been open, can open today, or you're going to open in coming phases, I urge you all to utilize the Keep Meridian Healthy and Open for Business program for the sake of our community. Thank you very much for the opportunity to participate, and I'm excited to see where this leads.
Thank you, Mayor Simonson and Council President Bernt. We appreciate your support. The premise behind our campaign was getting businesses open and restarting our economy. This is why this group was started. We initially pursued efforts to get everyone open earlier, but we also saw the bigger picture, bigger issue of reopening amidst the COVID-19 crisis. And will the public return to those stores when they reopen? We're contacted daily by our business members on how does the governor's plan apply to my business? When can I actually open? And what are the guidelines does my business need to follow? While the Meridian Chamber of Commerce is not an authority on this plan or the recommended guidelines, we are here to help Meridian businesses understand those the plans and the guidelines better. The last thing that we want to happen for our local businesses is that they go to the effort and the expense to open, bring back employees, restock their shelves, and the public, the consumers, not visit their establishments out of fear or concern for their safety. The Central District Health and CDC have developed some guidelines to reduce your risk when out in public. And if businesses can follow these guidelines as they reopen and demonstrate to the public that they're serious about the public safety and health, then that will build the consumer confidence necessary to restart our economy. The Meridian Chamber of Commerce is launching the Keep Meridian Healthy and Open for Business campaign. to help our businesses build that consumer confidence. As businesses open up to the governor's 4-stage Idaho Rebounds program, we will assist Meridian businesses by conducting industry-specific webinars that will provide information from the Central District Health and CDC on basic guidelines for that industry. The webinars will also feature local business leaders that have taken even further steps to ensure that they are reopening in a safe and responsible way. After our business participates in a webinar for their industry, they will be provided free of charge collateral material that's displayed in their stores that recognizes them as participating in the Keep Meridian Healthy and Open for Business campaign. These include door signage, like the logo you see here, and also posters that they can display in their store that details that we check the box and open for business. That means they're taking the steps to do these simple guidelines in order to keep their customers and employees safe. We'll also be providing social media materials for you to share online for participating businesses, and they will also be listed on the Chamber's website and included in our marketing of this campaign to the public. Our program goes beyond what some other communities are doing and just creating a listing of businesses that are complying. We are helping them understand what this means for business and sharing best practices from other industry-specific leaders. The guidelines out there are not a one-size-fits-all solution for every business. We don't know what we don't know. The industry-specific webinars seek to educate beyond a sheet of written guidelines. Educating businesses on the additional protocols they can implement for their specific type of business is where the value comes in, and that value is in safety for employees and customers. As the mayor mentioned, to be in compliance with the governor's 4-stage plan, businesses will only be provided the collateral materials when their business is scheduled to open and according to the plan. As a follow-up, after their opening, the participating businesses will be encouraged to answer surveys from the Meridian Chamber on how their opening is doing and the sentiments from their patrons returning to their stores and businesses. Look to the Meridian Chamber of Commerce and City of Meridian websites to see the schedule of industry-specific webinars starting next week. With that, I'd like to turn it over to Natasha Ferney with the Central District Health to share with you some of the guidelines for general businesses that are able to open as of today. Natasha?
Okay, yes, thank you, Sean. I appreciate this opportunity to participate in the webinars and talk about our resources and general resources that's available for businesses that wish to reopen. So currently, we have a guidance document that is available via Central District Health website. It is guidance on recommended guidance for businesses who wish to reopen. So this document was actually created in conjunction with Southwest District Health for workplaces to use in their planning for reopening or next operational steps. So we encourage local business community to use this as a source to plan for increased health and safety measures and as a source on information on how to communicate their plans to their staff as well as to their customers. Okay, so while my agency, Central District Health, can help answer questions that businesses may have for portions of their plan, there is no requirement for them to submit their written plan to Central District Health. However, we highly advise that that written plan is maintained in-house and kept current and to be and we advise businesses also to make their staff and train their staff to be aware of what is outlined in the reopening plan. Okay, so current document the recommended guidance for businesses was actually made available on April 20th. So it encompasses several criteria that we would like businesses to be aware of, and we hope that they will use in their planning process. So the guidance document includes general recommendations. It also includes recommendations on basic social distancing measures. It includes recommendations on employee education and also recommendations on plan activation process. So just to go over in more detail of some of those. So for example, we highly recommend that business community uses and places posters or signage of sorts at the entrance to their workplace and in highly visibility areas. So those posters should encourage patrons to not to enter the facility if they're feeling ill, or utilize cough and sneeze etiquette and exercise good hand hygiene. We also advise businesses to remind their employees to utilize best health practices by, for example, covering their mouth and nose with the tissue and coughing or sneezing, or to use the inside of their elbow to do so. So it is important for employees to remember to wash their hands for at least 20 seconds with warm water and soap. And if employees, for whatever reason, are unable to use a hand sink, a hand sanitizer should be made available to them. And the sanitizer has to be at least 60% alcohol. And CDC guidelines also provide more information on what that should look like. We also encourage businesses to educate their employees on not touching their faces, including eyes, nose, mouth, with unwashed hands. We highly advise that employees really follow their illness policy and ask those staff that are sick or experiencing any symptoms to stay at home. So as far as social distancing goes, so there are very basic measures that any business can take, and those can include usage of signs or taped markings to designate distancing areas where customers might form a line. We also encourage businesses to utilize by appointment scheduling system to reduce that foot traffic. So we recommend that businesses explore flexible work sites. For example, they explore the possibility of telecommuting. It would be nice to look into flexible work hours, such as staggered shifts, for example. And also we would advise that they consider having their employees to wear cloth face covering, especially if they're unable to maintain social distancing at least 6 feet or greater. So when possible, please discourage workers from sharing phones, desks, offices, or other work tools and equipment. Please make regular housekeeping practices, including routine cleaning and disinfecting of surfaces, equipment, and other elements of the work environment per CDC guidelines. It is highly recommended that businesses designate one employee who will be responsible for addressing those sanitation and cleaning practices. So we also encourage employees to do a daily self-check for symptoms of COVID-19. This would be fever of greater than 103 degrees, cough, and shortness of breath. And they should do that prior to coming to work. So for plan activation process, it is important for businesses to really make key decisions, such as who should be involved in the planning process, what events should trigger a particular action, what procedure should be used to activate or deactivate the plan. And they should also be prepared to work with the local health officials if any particular questions arise. Okay, so this guidance document, as I mentioned before, is available through Central District Health website. It can be found on our COVID-19 resource page. Also, if any business has any questions or seek an input on their already completed plan, they're welcome to contact us. And that information is also provided on our website. Okay, so thank you. That's all I had.
Thank you, Natasha. We look forward to the Central District Health and CDC as they start rolling out more of the industry-specific guidelines for businesses as they enter the different stages of opening. So thank you once again. Now, one of the most important factors that's been outlined all along is the importance of testing and tracing to slow the spread of the virus. Joining us today to talk about the availability of testing in the Treasure Valley is Dr. Tommy Alquist from Curve Idaho. Tommy, would you like to take over?
Yeah, thanks so much. It's just a total pleasure to be with all of you today. I got to tell you, a couple of weeks ago, or maybe it's a week ago, time goes by. It seems like a week's a year now, but it was probably only a week ago. I know you guys have been working hard. I was invited to be part of this group to just answer some testing questions. And I got to tell you, I'm just proud that we are a Meridian business. BVA Development is in Meridian, Idaho. It's our home, and I'm just blown away by the work that's done by this group. While many people were sitting back, waiting, wondering, okay, what are we going to do? How are we going to help our businesses? How are we going to get back to work? This group has been proactive. This group has been absolutely killing it, and I hope is the model for many, many other communities that are maybe a little farther behind on what to do to help their people get back to work. So first of all, congratulations and thank you, and it makes me very proud that we're a Meridian business there with you. I just, your leadership is that, it's leadership. It's not sitting back, it's being proactive. I know Mayor Tammy's on here too. She sent me an email at about midnight one night and said, hey, we got to get people back to work. And I know she's been a big part of this too. So thank you, Mayor Tammy. Listen, it was exactly 4 weeks ago last night at 9:47 p.m. when I'm laying there on my couch, paralyzed, thinking, what in the hell are we doing? How are we ever going to get back to work? And I was thinking, we don't have any testing. There's no direction. What are we doing? And a buddy of mine texted me from Utah and said, look, this group of business guys got together and they're going to figure out testing in Idaho, or at least help with it. And from that moment forward, it's been 4 weeks of just nonstop 20-hour days getting this thing figured out, because we knew that the only way for us to truly get back to work was to have testing availability. The reason we're in the mess we're in as a country, as a state, as a city, as families, is because we couldn't test. As an emergency room doctor for years, with illnesses coming through the door, if you had those tools to be able to test you and help direct patient care in a way that you could isolate the people that were sick and let the people that weren't sick continue working, that was our only hope. And we were caught flat-footed. What we were hearing is that there was no testing. And if you remember, all of the tests were reserved for sick people, which it should have been. Our main goal was to keep hospital capacity where it needed to be. My message to everyone today is that has been fixed and solved. at least for Meridian and the surrounding areas. Rural Idaho, we still are helping quite a bit. We were able in a few days to acquire the test kits that were the limiting factor, and we have thousands of them. Through Crush the Curve Idaho, we can run up to 4,000 tests a day for COVID-19. That's the nasopharyngeal swab. So as people go back to work, and with collaboration with the state and with the health departments and everyone else we're working with, anyone that starts getting sick or thinks they may have been exposed to COVID, the very first thing they should do is get in for a test. It is not just it's not just Crush the Curve that has those tests. Primary Health has those tests. St. Al's, St. Luke's, lots of providers have those tests. But I'll tell you, we have 4,000 of them that are available every day. So think about this, 4 times 7. We could do 28,000 tests a week through Crush the Curve. As a state, we have only done 20,000 tests to date. So the main message I want to give everyone is, as people go back to work, and if you think someone is infected, they need to be tested immediately and stay away from other people. If we don't do that, it takes several days before you start showing symptoms and you're already shedding virus. It takes several days after you start being better where you are still shedding virus. And as those employees expose more employees and family members, we could have another problem again. Right now, there is very, very little disease in our community. We have now tested 10,000 people for COVID-19 antibodies, IgG. And that number is 1.5% of people have had it. That means that 98.5% of the people coming back to work have not had COVID-19. We still need to be incredibly careful. The people that are positive, the very, very few, it's not a stamp of immunity. They need to be careful. But through the efforts of what you're doing here, keep Meridian healthy and open for business. Please, please follow the direction that you're getting. This is amazing direction from the Chamber of Commerce, from the City Council, from the city, and from our partnership with the health department and the state. If we can follow those regulations, Natasha just went through very well all of the different regulations that we want people to follow. Follow those regulations. If you have anyone that's sick, get them tested right away. And that's how we're going to stay open for business. So we have a website people can go on. It's continually getting better. We're communicating with people. We're making it as easy as we can for folks to get in for testing. And I'll be around for questions at the end. But again, before I stop, I cannot praise you enough. Thank you so much for what you're doing. We can't wait to be good partners and help in any way we can, any business in Meridian that's trying to get open and stay open for business. The first disaster of this virus is the human disaster. And as an ER doctor, I watched my friends in the ER completely call me and say, this is not the flu, this is horrible. The second disaster is the economic devastation that staying at home has caused in our community. That disaster is just starting. It takes a few months for the full impact of that disaster to hit our communities. And the better we can get people back to their jobs and get things going again, we will lessen that devastation. But we have to do it together. We have to do it the proactive things you're doing, and we have to test and contain and trace those people when they get sick. So I'll be quiet for a minute, but thanks for having me on.
Thank you, Dr. Alquist. We appreciate your support and leadership and everything you do in our community. With that, I'd like to open it up for questions. I'm going to click unmute all for everyone, so you can actually unmute yourself if you'd like to chime in for a question.
I have a question for Dr. Alquist.
Go ahead.
What is the turnaround time for the testing process, sir?
That's a great question. So the PCR test, the nasopharyngeal swabs are still being sent to 2 laboratories, and those turnaround times have been 24 hours from when they get the swabs. So that's about 2 days, usually by the time the results come back. And then for the antibody test this last week, it's about 2 to 3 days for the antibody test, but that's less critical. We have to use labs that get us nasopharyngeal swabs back within 24 to 48 hours, or we can't trace. And we're committed to doing that. So the nasopharyngeal swabs are 24 hours from the time they get the sample, and we're overnighting them to the 2 labs that we're sending them to.
That's impressive. To follow that question, did those labs that we're using have the ability to scale to the same volume that you're able to test?
Those labs are ready right now for 4,000. They're calling me every day and saying, hey, where's all these samples from Idaho? So yes, they're ready for the volume. We have put money in place to hold that volume for us, but they are ready for the swabs. What happened, just so everyone knows, is you go back 4 weeks ago, there was a lot more disease in our community. The social distancing worked. There was a lot more people being tested. Right now, there are hardly anybody being tested. St. Luke's just shut their weekend drive-throughs. We're testing about 100 to 150 people a day through Crush the Curve in the Valley for COVID-19, but those numbers are very, very low, so we have plenty of capacity right now. So yes, they're ready for us.
Thank you.
Tommy, I have a question.
Go ahead.
Hey, it's Jeffrey here. So how would a company go about getting all their employees tested to help the consumer confidence with their patrons?
That's a great question. So there's two different sides of this, and I want to make sure that I answer this correctly. No one is requiring people to be tested to go back to work. However, many companies, well over 200 companies, have already contacted us and said, to increase consumer confidence, we would like our people tested so that we know before they go back to work that they don't have COVID-19. The way you do that is just go through the website, and we have a corporate portal where we'll set up and schedule a time for your employees to come in and be tested, again, with that turnaround time so that you can say your employees have been tested if that's something you want. It is not a requirement, but many companies are doing it so that they can check. Because here's the reason why. With up to 50% of people being asymptomatic, they're wanting to check and make sure that there are no asymptomatic positives before they go back to work. And lots of consultants are telling companies to do that. We're just available with the testing if that's what they want to do.
Excellent. Thank you.
Dr. Alquist, this is Todd Christensen from CapEd. Can you talk about HIPAA and how this plays with HIPAA, one of our considerations at CapEd Credit Union?
Yeah, so great question, Todd. Hope you're doing well. So Crush the Curve has relationships with healthcare providers in the state. So in the Treasure Valley, it's Salter. In Pocatello, it's Portneuf. In Idaho Falls, it's Mountain View Hospital. And every test is actually administered by a healthcare company that follows all of the HIPAA regulations. In addition, every one of our databases is HIPAA compliant, and absolutely no patient data is shared with anybody except for the patient by the provider.
Thank you for the answer on that. A follow-up question: what is the availability of a company, or what is the protocols that you're seeing as it relates to best practice for sharing the information from employee to employer to manage it within the workplace?
Yeah, so that's a really good question, and I'm not an attorney, but I've been on the phone with a lot of them lately. And so what I'd tell you is you need to have your own corporate attorney, your own. So first of all, there's been a ruling by the government that businesses can require testing before they come back. Not all companies are doing that, but the first question is, can I require my employees to be tested? The answer to that, yes. Now, what if the employee, with their information that comes back to them that's private, it would have to be a voluntary letting them know, hey, if you test positive, will you let us know? And then how you keep that data private and how you keep that patient's confidentiality private, that is an internal policy that you need to discuss with your own legal counsel. But to your point, it's an excellent question, Todd, is the patient will get the information and the result and then need to share that with their employer. It's not the other way around. So it's not the employer testing the patient, it's the patient being tested and then getting the information.
Okay, thank you. And then my final question is, what is the frequency for the cycle of testing, knowing that you could be tested but then exposed 2 days later? What's the best practice in that regard?
Yeah, so again, I'll try to be really concise with a really good question. There is no standard on this. I think it depends on how forward-facing you are as an organization and how much customer contact you have and how you want to gauge your employee safety and how you want to gauge how often they might be being exposed. So let me give you an example. So Kristen Armstrong, we own a gym together, Pivot. We have elected to test everyone before they come back to work, and we're going to do a baseline antibody test just to see how many of the people that work for us have already developed antibodies. Not that they're immune, just to find out what they've been exposed to. we are probably going to retest everyone every 60 days to find out, have there been people that have seroconverted to IgG positive, so they've been exposed right underneath our nose while we've been open for business. That will be very helpful information for an employer, and or our practices being very safe. So there is no standard on this, but what we're hearing from lots of different companies is that based on the company recommendations from their own experts and consultants, that there is some testing over time. That's for the antibodies, but let me make sure the most important thing is said. The most important thing you can do for your employees is, as soon as anyone thinks they're sick, get them in for a test and have them not come to work until that test result's back, and keep them isolated so that we know how many people need to be tested around them. So to be clear, one is the COVID-19 virus test that happens immediately if someone gets sick. The other one is some interval antibody testing. That's totally elective if someone wants to do that, to track how you're doing as a company with immunity with your folks. Not because they're immune, but just to see how they're doing. Let me give you an example of that. So with an urgent care, if you had, let's say, 100 employees and 5 of them had IgG antibodies, and 2 months from now, 20 did, and they've been coming to work every day, that would be very helpful information if you're running an urgent care. If it stays at 5%, that will also be very helpful information. So we're in a world right now where data is our friend. There's almost no data that's not helping us, because this illness is new. We don't have a vaccine. We're in uncharted waters, and anything we're going down these roads, we're just trying to do best practices as we get through them. And some information used appropriately is better than no information. Hope that helped.
Thank you.
Thank you.
Mick Armstrong, you put a question in the chat window. Do you want to unmute and ask it yourself? I don't know if we've got someone on here to answer it, but we might.
Yeah, my question is, I know, or at least I understand, that the Idaho Rebounds is in part or in whole funded by some of the federal stimulus funds. And I know that the city is creating or has created a job board. And I'm wondering, is a possibility that we could add additional resources to help in this pipeline? If there are financial resources that we could use to help employers find employees, because as like Idaho Business Review has now started listing people that are employers that need employees, and I think from my count, there's easily 1,000 or more positions unfilled right now here in the Valley.
Mick, I don't believe we have anyone on from the Department of Labor or anything. Mayor, is there anything maybe the city's working on as far as that? I know you have a job board yourself.
Yeah, well, we are still waiting for guidance from the state on the funds that are being opened up to the city specifically, what is reimbursable or what those funds could be used for. So I think from that standpoint, when we're talking specifically about what the city may receive, we don't know. We hope to get that guidance next week. Other dollars that are more general, I can't speak to that, but I do think that Tori is on the call. Perhaps she can shed some light.
Oh, yeah. Thank you, Mayor. We aren't certain yet from Department of Labor, but that's one of the questions that we have into them. We're also looking for some specific information on unemployment numbers specifically for our community, so that we can identify those industries that are hardest hit and maybe create some programs and some assistance to assist them in getting back to business quickly.
Thank you. Any other questions for our presenters or for the chamber on our program right now?
Sure, Bob Ryder here again. Is there an FDA approval component to the testing or the labs being used in this process? Is that something that's governed by them, or is this an independent effort?
Both tests that we're using are FDA approved, both the antibody and the PCR testing.
Anyone else?
Hey, yeah, I got a question. This is Mike Laskowski. I'm the general manager at Fully Promoted, and we did all of the apparel and the promotional stuff for Crush the Curve. Nice hat, Tommy. I like it, by the way. I've been talking to Sean off and on the last couple of days about stickers and face masks and stuff that we're looking at possibly offering the community, or at least, and I heard some allusion to posters and things like that. At what point will we know that for sure? Just because if we're going to have businesses set up to open in stages and to be ready, we want to be able to communicate consumer confidence when they're walking up to these businesses. And a lot of that time on my end anyways, it takes time to produce the actual tangible goods. And so who is going to be the main point of contact for that for us if we're going to be doing all that? And at what point do we pull the trigger on some of those things?
So Mike, I can answer that question. I owe you an email back because you have given us some quotes on things. We'll be placing orders for a lot of the collateral material today. The first webinar for industries is next Tuesday. So once they complete those webinars, then we'll start providing collateral material. But we have several vendors that we're working with to try and get all of this information and materials together.
Okay. All right. Great. Thank you.
Okay. Any other questions?
Hi, this is Blake Jones from Idaho Press. So I was wondering, I remember earlier it being said that businesses would have the opportunity to put posters in their windows signifying that they were complying with city and central district health guidelines, guidelines in order to instill better consumer confidence. So I'm wondering, how is the city going to determine if these businesses are complying with those guidelines and then give them access to those posters?
So I'll speak to the access to the posters, and then I can let the city speak to the follow-up. We will not provide these posters or the collateral material to any business that has not gone through a webinar and at least been given the education about what they should be doing in their business to follow these guidelines. Nor will we give them the materials until they are in the proper stage based on the governor's plan of the 4-stage opening of the Idaho businesses. The Meridian Chamber of Commerce is not an authority. We don't carry any authority whatsoever to enforce these things. And so I'll let the mayor maybe speak to that aspect.
Well, Sean, to that element, I mean, this is a chamber-run program. This is not a city approval that they've adhered to any specific guidelines. So we are supportive of the chamber initiative that they have been running, but this is not a city initiated element.
Thank you.
Okay. Any other questions? We did get a question here in the chat. Is there a good source for a concise breakdown of the 4 phases? We do have that posted in PDF form on our website, the Meridian Chamber website. I believe the city has that as well. And you can find that on the governor's website as well. The PDF actually reads a little bit easier than the website does. So I would recommend downloading that PDF. There's no other questions. I'd like to thank you all for joining us today, and please help spread the word to all Meridian businesses that we're here to help them open in a safe and responsible way and want to keep Meridian healthy and open for business. Please visit the meridianchamber.org website for more information on this program and to sign up for our future webinars. The first one is already out there and you can sign up for Tuesday. We want to wish you a very happy weekend. Have a wonderful weekend, and please keep Meridian healthy and open for business. Thank you all.
Thank you.
Thanks, Sean.
Thanks, Sean. Thanks, presenters.
Thanks,
Thank
Sean.
you.